Hi, it's Mr. Divabetic. I'm at the No Diabetes by Heart, and it was an amazing event here in New York City, and I have one of the best keynote speakers ever. I'm so excited to introduce you to Dr. Hill-Briggs. Hello, doctor. Thank you for being here.
Nice to be here.
You were so powerful on stage, and I know my audience is going to connect with you because you're all talking all about the emotional side of living with diabetes, which I think a lot of times is doesn't get discussed. It's like under the radar, and it's really personal for you too. So tell us a little bit about your diagnosis to Diva story first.
Yes, so I was diagnosed with type 1 diabetes when I was 9 years old. I'm from Baltimore, Maryland, and the practice that I went to had never seen a person with type 1 diabetes. It was a great deal of trauma. It was quite an ordeal, even getting the diagnosis and then being able to find a way to get appropriate care. And so for me and for my family as well, it was all a big black box. It was so confusing for me. I didn't know what it meant. I felt afraid because it was unknown. And I felt extremely alone because I'd never heard of diabetes, and I certainly didn't know anyone who'd ever had type 1 diabetes. No one in my family even had diabetes. And so this really was all something new. I'd say it took me up probably to my 20s to really be able to integrate having diabetes with my life and own it.
And then you went into the medical profession, and now here you are working with the ADA, working with American Heart, and really kind of letting women know, specifically with diabetes, that they might feel isolated, they might feel alone, they might be overwhelmed. So talk a little bit about this term diabetes distress that you mentioned up on stage, and how that's different from depression.
Yes. So diabetes distress is a term that we use to really characterize a normal set of emotions that come along with having a disease such as diabetes and all the implications of it. You're a human being, and so something as huge as getting a diagnosis, something that's going to change your life, means that you're going to have a response. And people can respond in any number of different ways, but every woman, every person with a diagnosis like this should expect that they're going to be human and have some type of emotional reaction to it. Whether it's pulling away and not paying any attention, or getting completely obsessed with it, or being afraid, or even people who say, I'm going to now take this on and charge more, you're going to have a response. And so what's diabetes distress is a good way to characterize the fact that in research as well as in experience, people with diabetes do go through these sets of emotions. And that's a normal part of living your life with diabetes.
Is there less shame and blame associated with the term distress versus depression? Is that why we're seeing, there's so many terms in diabetes, sometimes I feel it overwhelms everyone, and so I feel like when people make this kind of choice of language, which again is so important today, is that part of the reason behind the idea of distress? And you even mentioned a little bit about the anxiety, which you just talked about, being different from depression. Is that why you think we're seeing this terminology change?
Yes. So the term diabetes distress is really to differentiate it from what we consider the clinical mental health disorders. So along that, there's a whole continuum of emotional experience a person can have. Diabetes distress characterizes the normal ranges of emotions that people have. We want to separate that out from major depression, which is a clinical condition, and something like anxiety disorders, another clinical condition. The difference is that when you have major depression or an anxiety disorder, those are not things that you can just cope your way out of. When I get up today, I'm going to talk myself through and when you're coping with diabetes distress, there are things you can do so that it doesn't interfere with your life or inhibit your ability to move forward. When you have a major depression or anxiety disorder or any other type of formal mental health condition, it requires some type of intervention from a healthcare professional. And it may just be formal talking therapies, psychotherapies,
Right.
or it may also include uses of medication when that's indicated. And then that's what enables people to be able to kind of jump back into life, jump back into managing their diabetes. When you have a clinical disorder that's not being treated, you just cannot, it's not possible to see beyond
Even go
that.
further than
That's
that.
right.
All right, so I want to end this with a little role playing, just like Angela Bassett. So it's all about Divabetic. Waiting to exhale. I'm now a woman in the doctor at my visit. You're my doctor. I want to talk to you about distress. You know, most of the women who are diabetic, they're not their number one priority. So I'm already dealing with type 2 diabetes, and now I have distress. How do I talk to my doctor about that? Because I feel like we want more doctors like you who understand how important the language is and also understand the emotional side of living with diabetes. So what would you tell the woman with diabetes how to talk about distress with her doctor?
So I think it's important to come in and be as natural and real and honest as is possible. And that would mean starting by sharing, this is what's been going through my mind. This is what I find myself feeling or thinking about. And I'm a little concerned about it. I think the greatest challenge is the other part, and that is how we can ensure a healthcare provider can hear that, receive that, not panic themselves, and be able to respond in a way that'll be helpful. That's by far the greater challenge that we have. People with diabetes are getting very good at being able to advocate for themselves, and if they don't bring it up in the doctor's office, it's more because they don't know that their doctor will be able to respond properly or help them, and so they keep it to themselves rather than burdening the doctor with something the doctor won't be able to handle. And so I think most of our work is on the other side, bringing healthcare professionals up to speed with the fact that diabetes doesn't happen to a rock. The diabetes is happening to a person who's bringing everything that they are striving for in life. And then this diabetes hits them. Diabetes is on top of a whole full life